no one size fits all. Like you mentioned, I'm not going to go through your slides like you did, but I'm going to start from the stress. You mentioned stress and sleep. And I was wondering, don't they say between 20 and 50 is when you build your wealth, you build your career, you don't need to sleep up to 5 hours in a day. Why are you telling us 7 to 9 hours and reduce our stress level because it's going to cause cortisol? Why do we have to slow down when we need to build and make the money now? What do you think? How can we achieve that recommendation of sleeping and we are young?
Right, that's a great question. At the same time, they say, right, if you're going to not focus on your health to build a career and wealth at this point of time, but then once you've made all the money and the wealth, if you're not going to get to enjoy it with a healthy life, how does all of that make sense, right? So of course we have to do it, and it's not just about building wealth at the same time, but at the same time, like I mentioned, women undergo pregnancy, and as a couple raising kids could also be stressful. So by that, what I mean is not that you should not you should still be sleeping for 5 hours. The only reason I'm saying 7 hours is that is the recommended amount of sleep that in general, not only 20 to 50, but adults need to, from starting from 18, you need to get that much of sleep, because sleep is directly related to the amount of cortisol that is developed, and a shift in those cortisol hormones can cause your insulin resistance, that is the major symptom of diabetes, to arrive faster. So lack of sleep, you can just relate it to insulin resistance building up in your body. So that is what I would say, how these cortisol, the stress hormone, is directly related to insulin resistance occurring at a much earlier age if you are not getting the enough rest that is needed for your body.
Thank you. While we're waiting for questions from our participants, I also want to preempt our conversation in terms of discussion this afternoon by saying we eat well. You mentioned carbs quality, especially when we're talking about, how to have your healthy plate. But specifically, you talked about the quality of our carbs. I'm like, how do we know what quality means in our carbs? For our members, is it that they should just eat anything and that's a good quality? How do we know about the quality of carbohydrate in our meals for the healthy plate you showed us?
Right. So, for example, I mentioned like white bread and like pastries. These are all refined carbs, right? Which undergo a lot of processing when it comes to when you go into the grocery store. You picking up white bread, and so you always have an option between picking up whole grains like a wheat bread or a white bread. So I would say you don't have to give up carbs, but the carbs that you select are more important than just saying I want to eat carbs. So that's what I meant by saying quality of carbs mentioned. Like, for example, people who like oats or cereals that have whole grain carbs, you should be focusing more on those kind of things.
Yeah, awesome. Thank you, sir. And so that's where I will come in to say for food literacy, when we're talking about, okay, what you need to eat, you also need to look at the meal planning, look at the snacking behavior of the person, the routine of the person. So an example of what you said, pick an whole grain instead of the white refined bread. You can also look out for fermented carbohydrates. That's good for gut health and, more importantly, fiber-dense carbohydrates. You mentioning don't just take something refined. I will delve more and say that the reason why we are telling you not to eat a refined food is that the nutrient density of a whole food or a whole grain based carbohydrate is higher, and the diet quality you're getting will help you achieve your aim of eating healthy as a lifestyle. And thank you, Dr. Kudchadkar. Like sometimes when we talk about eat well, lose weight, people just think it's generic.
Mhm.
It's why you need coaching. It's why you need a dietitian that understands you and understand your cultural competence. Let's
Yes.
not go into that. I have a question next for that. Like, my friend, or our guest, I call him my friend, is my friend, is Asian, but then I've tried biryani before. I think you made it. Was it you or Tanisha? With the curry sauce.
Right, right.
Yeah. And biryani is not something we eat like in Africa like that. Maybe some Northern African, maybe Egypt or Morocco. But the way it's prepared and the food content and the likes is different from my jollof rice. You remember my jollof rice? So, that also matter in what you eat. We have a question. I'll take it next. Thank you for that. So, how do you help our members get it in perspective that we're not just saying eat well, but understand what you're eating and plan for your meals. Even if you're working on prevention and not treatment yet, plan ahead for your meals for the modifiable lifestyle risk factors. Yeah.
Right. Yeah, I mean, like you said, someone who likes biryani and things like that, or let's say rice based, like what I can think of right now is, let's say, pasta. So pasta is you have, like, in a country like United States, you have like a whole aisle full of different types of pasta, and now they have lentil based pasta or like whole grain based pasta. So those are the selections that you may want to make in terms of, like, I know we only said white bread, but there's everything out there in terms of rice. There's brown rice, again, that you can make a healthier choice always. The second thing that I would say is, when you plan your meals, like if someone, let's say you said, likes biryani. Biryani is a is a dish which has rice, some flavors, and some sort of meat in it, whether it's goat meat or chicken or any sort of. I would say at the same time, all of your calories need not come from just biryani as a dish. You can focus on having non-starchy vegetables along with it, like broccoli or other legumes and sprouts and things like that, which also, like you mentioned, energy dense, right? You just don't have to get all your energy density from that one biryani. You can focus on having veggies at the same time, having some fruits. So you're filling your stomach with equal amount of all these macronutrients at the same time. So I would say maintaining a balance during your pre-diabetes phase is, you need to look for a balanced plate, like the picture that I showed in my slide, is what I would recommend moving forward.
Thank you. I like you said, nutrient density, but you've also ensured in your recommendation that macronutrients should be spread. You
Right.
should not focus on a simple biryani recipe, but ensure you have other macronutrients. And if you don't know macronutrients, I taught that in our community about 2 months ago, but I will explain it again. Macronutrients are the major food groups or nutrients you get from your food. And I mentioned that we have different food groups. According to USDA, we have up to 6 food groups. If you want me to give that again, I'll send the slide to the group. But it's just talking about your protein-giving food, your grains, your seafoods, your meat and meat product and all those things, but more of fruits and vegetables. Like the healthy plate is showed, half of it is almost fruit and vegetables on its own, without even the grains that should be whole grains and reduced anything refined, and also the protein, dairy, and the like. So, like Dr. Kudchadkar has said, understand what you're going to eat, but also the prevention of prediabetes is also mindful in weight and how it links to what we eat every day. So thank you for that. The next question that I said I'm going to take, I saw it on the chat. I give examples: fiber dense carbohydrates, which were explained. So based on the different time zones we have, we know Africans, Hispanic, Asian, people from the Caribbean have seasonal local foods that is specific to their regions. So if we're talking of broccoli, because we stay in the US, in Nigeria we have more of spinach, we have ugu, we call it pumpkin leaves, and they are specific. That's vegetables. So for carbohydrates, I know back in the West Africa, for us, we have tuber-rich foods like yam, cassava. Also, we have grains like maize. We have wheat grown in our northern region, but is not localized as if we grow it a lot. But when we're talking about fiber-rich foods, ensure that whatsoever you're eating is not really processed or refined. If that can give you an edge or a tip on, oh, this carbohydrate I'm eating, how has it gone through, let's say, refinement, processing? Then we should not even go to ultra processed foods that are already in the package and things like that. I would say we should eat something close to the earth as much as possible. If that answer your question, Maham, it's possible to give an example of fiber rich food because there's so many types of food, especially the carbs and grains, that I don't want to just say this food is the only fiber rich food. There are lots. There are lots. There are
Yeah.
lots. Grains, millets, sorghum.
And I would just want to add to that. Along with that, we have at least in India we have a lot of kidney beans, like black
Okay.
beans. These are known to like legumes, beans. These are known to have a magical effect on the HbA1c
Mhm.
compound in your blood, which it just has the ability to improve that and put you even from pre-diabetes to non-diabetes.
Yeah.
So I would,
Reversal.
yeah,
Or is that
right.
reversal? Or I don't
Yeah,
know.
like reversal, and also I would say stops the progression of
Diabetes.
diabetes. Yeah.
Hmm. So, can you talk more about that? Because I know some of our members that have diabetes as a condition. I don't want to call them diabetic, please. You know. So, how best can you advise more? Can you just speak more on that so that it's not like, oh, they say it can be reversed, then, you know?
Yeah. So first of all, I would say that these two conditions, diabetes and obesity, right? They are conditions that can be managed and not necessarily treated. Like for I will speak first about obesity and then about diabetes. So obesity is something, for example, even no matter how you lose your weight, whether it's using weight loss medications, whether it's bariatric surgery, or whether it's following a diet and lifestyle exercises, the moment you lose your weight, that does not mean you have been treated for obesity. You can say that your obesity has been managed, which you will have to still continue to work with your PCP or your healthcare provider to continue it to be managed. Same with diabetes. If you have reduced your glucose fasting glucose levels by taking insulin, that means your diabetes is being managed. But the moment you remove the insulin, your diabetes is going to come back. The same way, once you remove the effect of your weight loss medications or you stop following your nutrition and lifestyle approaches, your weight is going to come back. So relapse is a very common thing when it comes to these two diseases. So that's how I would put it. Focus on managing it rather than treating it. Because if you're able to manage the condition, you can live as though you have no obesity or diabetes because you're managing it, and your lifespan is going to be still the same. But if you're not focusing on managing it, like being mindful and being aware of what you eat or how much exercise you do, you may suffer. You may live longer, but you may not live a healthy life.
Hmm. Thank you. Thank you so much. That really speaks well. It's still related to the question we got just now, but I will still read it out. Um, this person said, "Thank you so much for an insightful lecture, Dr. Kudchadkar and Dr. Sawate. Thank you too. We appreciate. I really learned a lot from your point about lifestyle, diabetes, and health. My question is, what practical steps would you recommend for someone who wants to start living healthy, but often struggles to stay consistent with the lifestyle of living healthy? Like, say the person struggles to stay consistent. What are your advice?
So I would recommend, so when we see patients, we first of all, you need someone accountable. You don't have to do it alone. As I mentioned in my presentation, seeking out for help, like just very frankly and very comfortably, you asked me about how can I do it.
Mhm.
Going out there and seeking for help, like the clinic that we have, or there are several clinics that treat diabetes or obesity. Making yourself accountable is the first thing. Follow up visits, for example, if you're not able to, let's say you lose track, going and seeing the person who's helping you even once a month. For example, what we do is if in a diet certain things don't work for the patient, we switch that with another option, or we switch the exercises or the amount of intake or calories and things like that. And at the same time, having these devices that measure your health, for example, how many steps you've gotten in, how much sleep you've gotten in, having these devices help you stay accountable. Because you, of course, when you see it, oh, I've just got 5,000 steps today, tomorrow I need to get 8,000. So I would say don't focus on failing just one day, but look at the long term goals. In a month, how much you have achieved. Yes, there will be days where one day you'll just have to be at work all your day, and when you come back you may not feel motivated, but every day in our life looks different, right? So I would focus on like short term goals. If not today, I'll try again tomorrow. But using this accountability, using a healthcare provider and using a wearable device can help you stick to your how much calories I'm eating, how much steps I'm getting in, how much sleep I'm getting in. It is really helpful for most of the patients that we see. This is the outcome that we have seen.
Thank you. So I want to speak for my low income community members. Not everybody have access to wearable device. Not everybody can even see their PCP, like their healthcare providers, because some countries have low doctor to patient ratio. And so what will you advise someone in maybe a rural community and is still trying to be like, I don't even have money to see a doctor now. My health insurance is not kicking off. How best can I manage to stay on track?
So
Yeah,
is it
think about
right? Right. Is it just if it's an individual seeking for it? I would say it can be hard. But if it's a group of people, like how we do it here in the US, we have like a group who would be going on a marathon walk together. Like that way, you have accountability with your partners and your friends, where you are all focusing on one goal. For example, we have transport over here using buses, cycles. I would say rather focus on if it's like a short term, like the distance between point A to point B, I would say rather walk to that point, like walk to the grocery stores and then come back. And I don't know what's the accessibility towards like gyms and fitness studios and things like that, but I would say forming a group and like how we have this group right now, right? Trying to seek for help. The same group, if y'all can build a community together and work towards achieving it and having each other accountable can really help at the same time.
awesome, awesome. Just like we did our water intake challenge in July. I don't know if you saw me post that. And we really had a good turnout because a lot of people are like, oh, we feel a burst of a boost of energy level, digestion is doing well, trying to meet up the required or standard recommendation of daily water intake. So we can actually have support group, accountability group in your local area where you're like, oh, well-being matters member. Okay, let's take a walk tonight or tomorrow. How many steps did you take in? Even if you don't have a wearable device that can count that, if you know you're taking at least 2, 3 miles of walk every day, that's a start. Like you said, small actionable step is going to help. And are you preparing your meals? Hygiene matters, safety matters. Even if you have a little, try and combine it to make it healthy with veggies, fruits, and like we said, whole grains.
Yeah.
This is for people that can't even access a primary care provider, but it's also for everybody, even with the accessibility sometimes to the gym, some of us, especially moms that have little ones, find it hard to go to the gym sometimes. So I
Right.
rather like, oh, if I'm chasing my toddler, I'm also trying to get in steps and trying to help her play and also. So if you know you have some restrictions, try and see a way forward out of it.
Right. And as you rightly mentioned, right, a lot of people are in the same boat at a lot of times. Like there's a group of people who have the same work life. There's a group of people who, like say several, like say 10 or 15 mothers in a community may be pregnant at the same times. Like we have a lot of social media platforms right now where you can make those groups, and like how Dr. Mary, she mentioned about, you can explain what are the types of recipes that you're using for healthy cooking. And all these recipes and things are out there in like for example ADA or the CDC guidelines. They have culinary recipes on how you can cook your food well. So keeping accountability, let's say on a WhatsApp group, can keep you together. Oh, she cooked this today, let me also try that out. And things like that, you can help each other. People who in the same boat can use each other as accountability towards achieving your goals.
Okay. Thank you, Dr. Kudchadkar. Before we allow you to go, I want you to talk more on how we can ensure coping triggers, staying motivated. Like, oh, I'll take this 10,000 steps, I'm doing that, and then maybe life happens and you're like, oh, I just missed that. How do you ensure we keep on with the commitment of staying healthy or tracking my activity level, eating well, getting support? Most time motivations just go. What can you say from your experience? How can we just keep up with the commitment of I will do it, I'm gonna do it, and I'll still do it, and
Right.
identify those maybe environmental emotional triggers. Yeah.
Yeah. First, I would say, like we use I would to start. I'll just use a. We use the term a person with obesity or a person with diabetes. We use people's first language. The reason I'm mentioning it, there's a lot of stigma behind these two diseases, right?
Yes.
Like, for example, obesity is like a disease that you wear, and then how people look at you is like the person is either lazy or watches only TV or does not like to walk, or that's not how it is. Obesity is literally a disease that you may have right since childhood, and just
Mhm.
because this is how the person looks, it's not about all about eating. So first, that stigma needs to go away. And if you want to be motivated, first, family support, your social support needs to be strong. And with that, what I mean is it is okay to say no if someone wants you to, let's say, join them for a meal or join them for a drink. It is okay to be accountable of yourself and with your family that I will be doing this. I'm on a mission right now. And I wouldn't say you need to lose 50 pounds over a month. Focus on the short term goals. Like, even a short term goal within a week, if you've lost 1 pound, it is a win. So it's a journey rather than just achieving the result always. So celebrate those small wins that you have. First, accountability towards your family, your support system. Third, the stigma should go away. It is okay to reach out to these prevention programs, or, for example, we are doing a webinar like this because it is literally a disease and it's not in your control. But with proper support system, that is your healthcare system, your family support, you can achieve these goals one day at a time.
Thank you. Thank you. I want you to reiterate that with your family support, with your own motivation, you can achieve it one day at a time. It's not a sprint, it's a lifestyle goal. It's to have a better health outcome. It's not what you're doing just because you want to show off. It's for your health investment. So one day at a time. Thank you. There's a song that is coming to mind, but I'm not yet to sing. Like one day at a time is real. So trying to get you more healthcare providers that can answer your question. We'll be having a session on nutrition and cancer prevention, cancer management soon. We already have our guest confirmed. So from TTU El Paso, TTU Health Sciences El Paso. You know the person when I share the flyer. Yeah. So thank you, Dr. Kuchaka. If you know you're willing to join the Wellbeing Matters community, it's community where we advocate for optimal health, but more importantly, we engage you. Our Trivia Thursdays, we ask questions and we provide answers to the questions to keep you informed and also committed to you learning not just new information, but applicable health-based information. Your parting words, Dr. Kutchaka, what would you like us to say? Or like your key takeaways, even from what you said, that don't forget this, do that. Thank you.
Yeah. All right. Thank you so much for this opportunity. And like I said, your health is in your hands. So start today. It's never too late.
Your health is in your hands. start today, it's never too late. Please, please reach out to us if you need more support.